Hi, everyone. This is Susan Clinton, one of your co-hosts for Tough to Treat, and this is episode 161. And I just wanted to pop in and welcome everybody back to the podcast. This is going to be a podcast that's going to have a little bit of some complexity to it that I thought would be interesting for everybody to listen to and to kind of think about what your thoughts would be as I kind of move through this scenario. There's a lot to discuss here, so I hope you enjoy the podcast. Thank you. Hi, everybody. Welcome to podcast number 161. This is Susan Clinton, and I'm here with my great co-host, Erica Mello. Hi, Erica.
Hi, Susan. How are you today?
I am good. Spring is finally springing in the Upper Peninsula of Michigan, so
awesome.
We're getting some warmer days and looking forward to our upcoming summer months.
I know. Time's flying.
Yeah. Okay, let's hop right to it.
Let's go.
This is a client that I had a number of years ago, not too many years ago, but a number of years ago, that actually was a friend of, a friend of mine. So it was kind of a, reluctantly, he really didn't want to come, but he knew he needed to do something, and he did not want to go to any physical therapist in his area or community. So he traveled across town to see me, basically. But this you'll kind of get the story here a little bit. This is a guy that is in his mid-40s, and he's a surgeon, a vascular surgeon. And so he wears loops for microsurgery. The loops are those are the glasses, like the magnifying glasses.
Got it. Yeah.
He's doing microsurgery for 10 to 14 hours a day, 2 to 3 days a week. So you can already get the picture of what this guy looks like, right?
Yes. I've got the visual.
Yeah. So, bent over in these positions for long periods of time.
Yes.
But 2 to 3 days a week. He won't do surgery any more than that. He just, really feels like, if he does any other surgeries, they're short surgeries and things, but he plans these only 2 to 3 days a week because obviously the toll it takes. Yes. For exercise, he rides a bike, and he's been unable to do that because he has this 6-month onset of hemorrhoids that has started. So he can't ride the bike. So he's beside himself because he has no way to bring himself down. Yeah. And so here's the thing. His complaints are the following. Fatigue, eye fatigue, neck fatigue, of course. Makes sense with leaning over. Yeah. Shoulders are sore. But the biggest problem that he has is what he considers chronic low back pain and chronic bilateral heel pain. And so this is why bike riding was his thing, because he can ride a bike. The interesting thing is he chose the one activity that puts him in a flexion bias.
I was just thinking that. He's got his head forward.
Exactly. And he leans forward over his bike with his, so he's got this upper thoracic, kyphosis piece. Going on. It's not full thoracic, it's more upper. He actually tends to, when I asked him, I said, show me what you look like in the surgery, in the OR. Just get in that position. And he did. And it was, as you would expect, it was like, a forward thoracic, kyphosis, but it wasn't the whole thoracic spine. It was the upper part that, kind of almost like Scheuermann's disease, where they have that, that whole bent over upper part of the thorax and that forward head.
Yes.
It wasn't that bad, but it had that look. And his feet hurt. And so he can't allow his pelvis to go back. He tucks his pelvis up underneath him to get off of his heels.
Yes.
Because I asked him, I said, can you let this go? Because his back is hurting.
Yeah.
And I'm thinking, okay, he's probably getting some compression on the facet joints.
Yes.
Because he's standing in kind of like lumbar extension with this forward thing. It's like, ooh, I can just, the neural tension is killing me.
No
just
wonder he's
thinking
going
about
forward.
it.
Yes.
Yeah. And so I asked him, I said, how do you like deal with this? And he goes, I tune it out. I don't think about it.
Mhm.
I'm so into what I do that I just don't think about it.
Mhm.
And he said, for that reason, I don't like taking breaks because then I go right back into my body and it hurts.
Mm,
And I said, well, you
interesting.
can't keep going at 10 to 12, 12 to 14 hours a day without a break. You just can't, So he knows that. He's like, it's one of these things. I know what I should do. I can't do it.
Yes.
Kind of, thing.
Yes.
Like,
Yes. And it seems like healthcare professionals, we're very much like that, right? We can
yeah,
take care of other people, but how about
right.
ourselves, right?
And he's like so into what he does and he just doesn't think about it. And then when he has to come back into his body. So anyway, he chose biking a while back because he couldn't walk like for long distances because his heels hurt. And he wears he was wearing Crocs for a while, but that made the heel pain worse. So he kind of got into these clogs that a lot of surgeons wear.
Mm-hmm.
And they do it on purpose from what he told me. He said, because they can kick them off and put them back on. Right. And they don't ever have to touch them, and they can have the little booty on them, and and they can,
right,
so,
right.
And he doesn't really do that, but it keeps him forward so that he's not on his heels,
Right.
So,
and in those shoes, hurts. His heels still hurt in those Crocs.
Yeah.
Okay.
Yeah. They just hurt, so, especially when he's like using the loops. Like he says, it's not as bad when I don't have to use the loops, but with those long surgeries where he has to, because it's microsurgery that he's doing.
Yeah.
So the other interesting thing is so I asked him, I said, have you been on how did you take care of this before? He said, I sat down. Mm-hmm. And he goes, I can't do that because I have hemorrhoids.
Oh God,
his hemorrhoids are so bad. So you see the dilemma this poor guy's in. And so just like, okay. And then the final thing was, so I said, tell me about the rest of your life. Like, tell me about everything else. How's your sleep? What do you eat? Do you eat during these surgeries? Yes, you have to, because you have to keep your energy up. So that forces him to take breaks. And I said, what do you eat? And he goes, well, mostly junk, sugar stuff. And I said, so he's terribly constipated, and that's why he's got hemorrhoids. He could do, I said, you could do it when you were 30, right? He goes, oh yeah, no problem. It's like, we adapt until we can't. Guess what? That's not going to work for you anymore. Yeah. And on the days that he does these surgeries, these long ones, he's up all night going to the bathroom.
Oh boy.
So, which is why he won't do these 2 days in a row, because he said, I just can't, because I don't sleep that night. And then it takes a whole nother day before, and then that following night I can sleep, So it's kind of he's in a bit of a dilemma, and he's starting to break down pretty quickly.
Yeah.
So there's a lot to kind of consider here with this guy,
whole lifestyle, right?
Yeah, exactly. You got to have any thoughts about where you would start with him?
So you said something interesting where he said when he's bent over with the loops, his heel pain is worse.
Yeah.
Or it's better. And so I'm just thinking, full body neural tension.
Yeah, 100%.
That's what right there. I just looking at I'm just looking at because I've written it down. I would start there, or the upper quarter of the neck. That's where I would go.
Yeah. And so, 100%, there's a couple of places to kind of consider here. Realizing that constipation and hemorrhoids and his position of power that he has to work in could also be a pressure management problem inside. So we've got two things that are kind of prominently sticking out here: the neural tension and the lack of range of motion that's starting to creep in from being in these positions all the time, and favoring even biking. Like,
even thorax. Yes.
I asked him, I said, did you ever do the row machine? And he goes, I can, but I just would rather be outside. So that's why he chose biking, because he could get out and he could exercise. And I said, when you
had no symptoms from?
Huh?
No, go ahead, Susan. I'm sorry. Go ahead.
No. What'd you ask?
He had no symptoms in his neck and shoulders on the bike?
No.
Okay.
No, the chronic low back pain was the big thing.
Yeah. Okay.
And he didn't have, when he was biking, I said, when you were biking, because you stopped 6 months ago because the hemorrhoids started, I said, what was happening at nighttime then? And he goes, it really wasn't having any significant problems. And it was like, okay, so one of the things we've lost here is the pump, the vascular pump, because he doesn't have any way to exercise to help, overcome this chronic standing posture, and he can't alleviate his back pain because he can't move into flexion because it makes his heels hurt.
Yes.
So, which is kind of interesting because his heels hurt even if he leans forward and
Right.
comes straight through his back. They're just hurting all the time, but he thinks they're
Yeah.
worse if he like lets go.
Yes.
So,
Yes. Yes.
so we had a lot of things to kind of start here with, and so I basically asked him what he thought was going on.
Hmm.
Do you tell me what you think is happening here? And he said, I think the problem is I just spend too much time in one position. And it's like, okay,
Fair enough.
fair enough.
Yeah.
Do
Hmm.
you tell me what's on the table and off the table? Because there's no point in me coming up with recommendations if it's going to
Hmm.
be that's not possible, that's not possible, that's not possible.
Right.
So I told him, I said, I'm not in the OR. You've got to tell me what is on the table and what is not.
Right.
You can't sit right now because it hurts to sit because of your hemorrhoids. Do you tell me what you can and can't do, what's possible and not possible? So he said that he takes breaks when he can, no longer than 3 hours to eat and to move around because they have to, to do that. And I said, okay, so you are moving, you're getting something to eat. We're not real crazy about what you're eating. And do you have any ideas about any kind of food that would give you energy besides peanut M&Ms and the
Right. So
coffee,
God.
right?
Yeah.
And so, yeah. So, anyway, the bottom line is he does have the ability to move.
Yeah.
He can, because he can't touch anything. He does have a really good OR nurse, two nurses that work with him, and they're capable of moving things into position for him in different ways. He said, I just don't ever ask them to do it. So
Yeah.
we got some, so basically his biggest thing was I stand in the same position all the time. And that's why all this is happening.
Yeah.
So, it was good to get there because then he could start the problem solving kind of thing. And I just think that he just he's so focused on his work that he just comes into the OR. It's a routine. They all know it. They just dive in and they do it. And you never think about the simplest things, which are just changing positions or postures or
your environment.
And so I said, are they willing to work with you on this? And he goes, oh, they'll do anything I ask them to do. They're great.
Yeah.
So,
yeah.
And, so we kind of started there. And I said, let's talk about this like full body pain. And we talked a little bit about neural tension, of which he knew nothing about, but it made sense to him. And we talked a bit about pressure management, thinking about breath holding and stooped postures and the diaphragm being in the wrong place to work. And what we do know about what the diaphragm does with chronic low back pain is it tends to become a postural control muscle. So there's a lot of pressure into the abdomen that doesn't belong there. And constipation isn't helping that any because it's adding more pressure and it's inflammatory. And, he's had these hemorrhoids that he just can't solve. So, the place where I decided to start with him, because he was going to start figuring out how to start moving around. I wanted to get that into place first, so then we could start addressing neural tension during his break time. But he needed to kind of start to get that in place and capture some more information for me on that. I decided we're going to start with, since you're having these issues, and sitting down isn't going to work for you, let's start with thinking about how we can change the pressure situation that's going on. So basically what I did was I took him, and I don't usually take people down this low, but I really felt like with his neural tension, he needed to his whole system is just, up in arms all the time. Can you imagine the sympathetic overdrive for a person like this?
Yes.
So I really wanted him to learn how to like chill his jets, the best that we could. And so I asked him, I said, what's your routine like in the morning, at night? He said, what I really like to do is I like to lay down. And I like to, sometimes he goes, if I can, I like to lay down on the floor and put my feet up on the couch, like, into a 90-90 kind of position, which is like perfect.
Yes.
And everything feels good that way. He said, it feels fantastic. He said, although it bothers me because I have to put a pillow under my head. It's like, that's fine. So we basically set that up and got him into that position. And because I wanted all neural tension gone.
Yes.
I didn't want to start fighting with neural tension at this point. I just wanted to see if we couldn't get his thorax to extend.
Yes.
So in that position, we did some breathing, some low level breathing, easy breathing, longer exhales, so that he could get his system to calm down. And we did some stuff where, just put your hands on your upper chest and bring the air into your chest. We did some visualization about the lungs and this stuff. He thought it was really funny, but he goes, he said, 10 years ago, I would have laughed at you. And it's like, well, it's okay. You're not laughing now. So that's good. And he said, but no, he goes, I get the whole meditative breathing thing. He goes, all of my colleagues are starting to do it because we're finding that we have to. So he bought right in, which was good. And so what we did was we created a progression for him. So he started off with nothing and a pillow under his head where he was comfortable. And got him going with the breathing. And then the next thing he did after that kind of calmed down and he could feel a little bit better, then he rolled up a towel roll and put it longitudinally underneath his spine.
Yes.
From like C7 to T12, a nice hand towel.
Yes.
And I said, this is fairly aggressive. So you're not going to lay here longer than a few minutes. So if you feel like you're going to fall asleep, set an alarm on your phone or something next to you.
Yes.
And he said it doesn't feel aggressive at all. And I said, just lay there for a little bit.
Exactly.
You'll feel it. It's like pulling your finger backwards, it doesn't really hurt. That feels okay. You leave it
once
there
you move
for
out
a
of the
bit.
position. Yeah.
Yeah. So, and then he did the same breathing stuff with that, but I wanted to help him begin to move his spine in a different position gently. So I thought he's going to be struggling, trying to push his spine backwards and do all this stuff. I thought, let's just use the floor to help and the towel to help. And then the breathing to be the to be the mobilizer for him.
Yeah. And I was just thinking, because I've been just doing some reading lately, and you think about like in the lungs, that suprafloral membrane, it attaches up to like C6, C7, right?
Right into the lower cervical spine.
Yeah. And so it's all related. It really
and as it
is,
comes
literally.
out, right. And as it comes out, it's all involved with that part of the brachial plexus.
Right.
Which for him, C6, C7, that's like little fingers, and if you're in that position of internal rotation with the forward head, I'm surprised he didn't have neuropraxias or tingling in his little fingers and his fourth and fifth finger, but he did complain of aching, in his hands and his arms. So it makes sense.
Yeah.
So we definitely like opened the arms out and laid out and did, some different things to get him into different postures. And then after he did the longitudinal towel roll for a few minutes, then we took it and we figured out, I said, tell me where you feel your spine on the floor the most. And he could tell me. Is that basically what I was doing was going after the apex of the curve.
Yeah.
And I said, where you feel that the most, I want you to put it just underneath that. I don't want you to put it right under there. I want you to put it just underneath, either underneath or above. You pick. And so
horizontally.
Yes. Yeah. Horizontally. Yes. Thank you. And so he did that. And I said, and then that's another 3 or 4 minutes. And if you can get this in every day, that would be great.
Yeah.
So we progressed along the line. So I'll progress this part first, and then I'll talk about the neural tension in a minute. We progressed to exhale, to doing this work in sitting, and yes, it's uncomfortable to sit, but if you sit in a different position, it's probably not as uncomfortable. So we got him set up where he was sitting on a pillow, and, he had a nice back support, and he could sit there for a bit. And it's like, so we could actually, because you can tell where I'm fixing to go with this. So we did the same type of breathing and sitting, but he could actually extend up and extend towards the back of the chair, a little Mackenzie-ish, like bringing the head back and bringing the thorax up, lining up over his pelvis, for a few minutes, just getting used to that position and posture. And then we started doing the leg come up, with the foot back and down.
Yes.
Either leg, and staying, of course, out, and he would feel this going down his calf and into his foot pretty quickly.
Almost like an extension slump.
So we just kept them there easy. And I said, just go easy with it. And so he started working on doing his neural tension there. And then to make it harder, he could not get his hands up to his ears. If you think about the ulnar nerve tension where you bring the hands upside down onto the ears.
Yes.
He could not get there. He couldn't even come close.
In general sitting, or in the extent really?
He just couldn't. It bothered him too much. Yeah, and it made his back hurt. And
interesting.
he was just too. Yeah, he's just tight everywhere.
Wound up.
So you can. So I said that then let's just put all you need to do is, can you put your hands on your shoulders? No, not really, not comfortably. And I said, okay, cross your hands over your chest. we're going to go with where it's the easy, we just need to get you wound up a little bit up high. And so we did that with the legs, and then we added the, cervical, dropping the head, to get that to come in. And so that's kind of where we started. And then I think everybody knows the story of tensioners and gliders. We moved him into more and more difficult positions and things as he got good at it, because this is what happened when I asked him to go back to the OR and figure out what he could do movement wise. He told me he could move his body into just about any position he needed to. They would just have to move the loops and let him move for a minute or two, and then they would put him back. Not the loops, but the machine, the stuff that he was looking through.
Yes.
So they were happy to help him reposition. So one of the things we bargained for was, can you have a chair in the OR that you can go sit in like this? And he said, as long as it's sterilized and the cushions are wrapped. I said, can it just be in there? And he goes, yes, it can definitely be in there. And I said, will you do this? And he said, actually, yeah, I think I will, because it always hurt to sit. I showed him how we could sit a little differently. He just, it's all things we know. We just sometimes need to talk it through.
Yeah.
So he said he would do that. So then I said, then we can do these neural tension exercises. Well, how we progressed him was where he could actually stand and learn to let his back flex and then come out of it and go into it and out of it without making the heels feel worse. Yes. Eventually I got him to where he could like bend all the way over.
Yeah.
It took time. It took time. Yeah. He got to where he could bend and put his hands on his thighs and bend and straighten his knees and, do his back into flexion extension and his head down and up. And then we kind of, just basically sent him on a program of this progressive movement.
Yes.
Paying attention specifically to the neural tension piece.
Yes.
And then, after we got that, then we get the arms up over, he could get his arms up closer to his ears. Nice. He could stand in different positions. He, got to the point where he could squat, so he had some movement possibilities that didn't take him very far away from the OR, what he was doing. Yes. It was enough to alleviate tension for him.
Yeah.
So
I had a patient. Oh, I'm sorry.
Go ahead.
No, I had a patient who's a dermatologist, and she was very similar. And she wasn't in the OR. She was looking into a microscope, and it was very similar. And I just made her put her foot on a small step stool every so often just to take out the knee. And it's a bit harder when you're in the OR, but your creativity is the limit at this point with something like this, right?
Exactly. And he's not one to have music on. Some docs really like music. He said it's just too distracting for me. And I said, well, what would be undistracting? And he said, it's just better if it's quiet. So I didn't even bring up white noise or brown noise or any of that kind of stuff, just like he wasn't into it. That's fine. Yeah. But we needed to solve the constipation problem too. So I taught him how to do his abdominal massage. We talked a lot about what he considered, was he willing to change his snacks? I said, I know why you're eating the sugar and drinking the coffee. Your brain needs the glucose, and it's the fastest infusion you can get. However, if we can get your system to work on if we can get your factory to work in another, with another fuel source that would last longer, and you didn't feel the need to eat so much sugar, would you be into that? And, he said, yes, he knows that he needs to do better. He just, again, I don't think about it. And then when I'm in the OR, you just do you just revert back to your habit, and it's like, so we have to do a little habit busting. So he started designing snacks that were going. I said, I don't care if you want to eat the peanut M&Ms. I'm not going to tell you not to. I'm just going to ask you to eat a protein source with it. Let's pair those carbs with something you can use. And then and so he started doing that. And I said, now you need to add a fiber with it. So eventually what he ended up doing was crowding out the peanut M&Ms by adding an apple and peanut butter, or an apple and almond butter, or an orange and some nuts and, things that he could chew. Yeah. And, and if, as long as there was a carb in there to kind of help the energy going, the protein was able to keep the factory going for longer periods. So he got into that. And the other part was, he knew he needed to start doing some stuff. We got him on a little bit of Miralax to kind of get the colon cleaned out. And, he said, I need to do a clean out anyway, because I've got to go have a colonoscopy, because he was just over 40. And, so we said, well, this is a good time then, you get things moved out of there and you can start eating better and a little cleaner. But the way we solved the exercise problem was pretty interesting. He was not interested in riding his bike because he knew that it was highly irritable to his hemorrhoids. It was like, I get it, but you got to do something.
Mm-hmm.
You have to balance yourself out somehow. He wasn't interested in going to yoga. He just wasn't, because I was thinking, well, maybe something a little stretchy can help the nervous system.
Yeah.
So I convinced him to take a Tai Chi class.
Nice.
When, after we started kind of getting some movement into his body, I said, why don't you go, does that interest you at all? And he was like, oh, actually it does. I've always been kind of thinking I'd love to take martial arts and do that. And I said, well, this is going to be more of a calming kind of one for you. So it's going to balance out your stuff. Give it a try. And I said, you don't like a lot of noise. You've made that very clear that, in the OR, he doesn't really listen to like music loud in the car. He just doesn't like that. And again, he's so hyped up. I can see why. It's probably like reverberating. Yes. And I said, why don't we do this? Why don't you do you have access to a pool? And he never thought about going and getting in the water. Yeah. And I said, why don't you go and just walk in the water, go to the deeper end where it doesn't hurt your feet and just start moving around. And, he actually eventually kind of took over, so that's where we started. And I said, put earplugs in, or don't go when there's a bunch of kids there, or put earplugs in or whatever you need to do. Mm-hmm. So he started doing that. He decided, what the hell, it's not going to hurt anything. So he got into the pool and started doing that. And he got into where he was kind of moving around a lot more in the pool. And he really, really liked the buoyancy of it.
Yeah.
So interestingly enough, he wanted to swim. So he started grabbing the kickboard. We talked a little bit about it. And I said, you need to find a swim coach, that can work with you where you are. And so, but I said, in the meantime, just grab a kickboard and start it with it at your chest and just start kicking, into the water. And then when you feel like you're able to, just move the kickboard out in front of you. And I said, you can even just like put your whole face and head in the water and then come up for air and go down. And when you feel like you can turn, you can start playing around with that. He started doing that. He really liked it. What he liked was it was so quiet when he was underwater.
Yeah.
He said that just was everything to him.
Interesting.
He didn't even know. I know, right? It was just like fun. He just needed somebody to just talk to. Yeah. What he didn't know him, which is what was really good, because all of his friends were sick of him bitching and complaining. Yeah. He just needed somebody to talk to him that wasn't going to judge him.
Yes.
Or he didn't feel like was going to judge him. So eventually, this is a year later, he got with a swim coach. And this guy swims miles, and he's so much straighter and he's so much happier, and his feet still hurt and he still gets some back pain, but he goes, I'm just so much happier. No, he goes, everybody, we have a routine in the OR. They all move, because he's like this, because he realized what's happened. But once he really started exercising and changing the way he was eating, his hemorrhoids, even with the pressure situation he was under, with the breathing and stuff, he got so much better.
Yeah.
He said, I can tell when I'm stressed because I get a little flare of the hemorrhoid pain.
Yeah.
But if I do all of these other things, I do really well. It was just really fun to watch. And I thought I'd throw that in there because sometimes it doesn't take a ton of things for these very complex patients to get things going in the right direction. Some short-term things that we did to help him was he needed to hydrate more with the constipation. So he and I kind of did a parking lot type of thing. I said, let's ballpark this and, or parking lot this and see what we can come up with. So when you throw ideas into the parking lot, to see. And so one of the things that we came up with was a camelback hydration system, like if you were out hiking.
Oh, yes. Yeah.
And he said, yeah, I can do that. And
That's a good idea.
I said, okay, yeah. So He did. So he started wearing the camelback, which I wasn't excited about him weighting his thorax, but he needed to
Right.
drink more water.
Yeah, yeah,
And
yeah.
the OR nurse could put the straw in his mouth and take it out.
Yeah, yeah.
So, it was just one of these big things was he just wasn't utilizing his people around him. He needed support and he
So
wasn't asking
typical.
for it. And they didn't know what to
Yeah,
do.
yeah,
They
yeah,
were
yeah,
delighted to be part of his thing.
yeah, yeah.
He also, I got him to start wearing compression socks
Oh, interesting.
while he was in the OR, because I think a
Why was
lot of
that?
his fluid was pooling down in his lower legs. And so when he lays
Uh,
down at nighttime to go to sleep, diaphoresis
of
gets
course.
started and he has to deal with all of that excess fluid down in his body, even though he wasn't like
Uh,
visibly swelling, but he was
yes.
in one position so much.
Yeah,
And,
yeah.
and
That's a
that's
great.
why I think he really liked laying down and putting his feet up, because it alleviated a lot of that kind of,
Yeah, yes.
kind of pressure.
Mm-hmm.
So we got him into compression socks. And then one of the other tricks was when he was on break, of course, you'll love is put the tennis balls underneath your arms. He had his little basket of things that he could go and do when he took his break, and he had to scrub out and scrub back in.
Yes,
So
yes,
that
yeah,
was
yeah,
when he
yeah.
could grab tennis balls and he could eat and do, some other things, and
Yes.
then, head back in. So the tennis balls were great because they just took the pressure off of his arms from being in those positions for so
Yeah,
much.
yeah,
And it also mobilized his thorax, which I liked. So
yeah, yeah, yeah. Oh my God. If you think about it, 12 to 14 hours at a clip and just bending over like that, it's,
mhm.
he has to do that, but he needs to be able to go the other way, And I like the swimming too, because you think about it, I was just doing a visual in my brain. When you're prone on the kickboard, and you push the little kickboard out in front of you, you're almost like just associating the scapula off the thorax and getting that disassociation and
Mhm.
decompression. And that's, the best for him. And, it's so interesting with, what was I going to say now? I just lost my train of thought. Oh, the tennis balls. I give that out a lot, to people.
Mhm.
And it's just like throw a towel, or some people actually buy those the orange Franklin balls.
Yeah,
But and
anything will
it's
work.
had
Mhm.
somebody drive home with them, and anything just to give yourself space. And it doesn't,
Mhm.
like you were saying, it doesn't take a lot in terms of just, little resets throughout the day. But because that was a large part of his issue, that if you didn't address that, what would have happened? I don't know, but the neural
Mhm.
tension piece was clear. And I love the way you did all the different positions. I mean, you could gosh, I remember a patient years ago, I gave her an exercise to do like pre-run, and it evolved. And the last one was she was doing like a headstand, like as a reset, because it was something that
Yeah,
she needed, right? So I
it's
think that's
amazing
important.
stuff, especially when they,
Yeah,
if they can get creative and figure out what's going to work in their life.
right.
This guy wasn't going to stop and do these other things. That's why I asked him in the beginning, what is on and off
Yeah,
the table? I need to know
right.
what's possible. Because if there's a possibility, that's also looking for change talk too, right? Like, where do you
Yeah,
really
yeah,
want to change?
exactly.
Can we sneak in, we grab that piece there and do it there?
Yeah.
The other thing that I did when I got him up into sitting to increase the movement of his thorax with breathing was to to sit and hold on to the arms of the chair so that his
Mm-hmm.
arms are fixed and not moving, and to
Mm-hmm.
take a deep breath in so you could feel the pectoralis muscles on the chest wall lift the chest wall up in that point. And so he could
Mm-hmm.
actually change the breath mechanics, which is what he needed, was variance. He
Yes,
was in this
yes,
one posture for so long, his body was
yes,
staying in it all the time.
yes,
So that's what
yes.
ends up happening. So yeah, so we did all of those things, and it was really he was fun to work with. You
And
know,
his hemorrhoids went away and everything.
his
That's
hemorrhoids did
awesome.
he did so that story is pretty interesting. He went to get his colonoscopy. He never ever had a GI appointment. And doctor, heal yourself, right? He said, I know what I need to do, I'm just not doing it. And it's
Yeah.
like, so he did the clean out, which was awful because he was so sore and painful and all the stuff. But he had his colonoscopy, and the GI doc said, you don't do something about these, we're gonna have to ban them. And he
Mm.
said, okay, I'm on board. And that's what did it for him. Like, he was willing to start to change his diet a bit, but that's when he really stopped eating the junky food,
Yes,
because he
yes.
started adding, was willing to add more fiber in and do that and really
Mhm.
get rid of the unhealthy food. And he even like switched over from coffee to he did better with a caffeinated tea. It just felt better on his system. He made some of those changes were made because he had that conversation with the GI doc who, threatened to ban his hemorrhoids and you wouldn't be able to work and do things for a while. And he was just like, I have to see if I can get this much better now. I'm like on board.
That was motivating.
Yeah. So sometimes motivation comes from other places too.
Exactly.
But yeah. So, he had a lot of things going on. The compression socks, by the way, helped tremendously. It didn't solve the problem.
Yeah.
What solved the problem was him starting to exercise again and moving more. That's what solved the problem of being up at night and going to the bathroom, because he thought I must have a prostate problem now. And it's like, maybe not. It may just be diaphoresis because of the way you're standing all day long.
That's a great idea.
So he got some running socks and started wearing them in the OR, and he loved it. It worked really well.
Yeah.
So that helped. So there's all kinds of things here, but it's all just like, where can we kind of like, what string can we pull on today? And what are you willing to do? And if we can get you to, do these breathing exercises every day, it's going to make your stress levels go down. We have research that shows this. Yeah. And so, when you can point to the research for people like this, they're in. And he already knew the research on meditation, and his colleagues were starting to do it. And I mean, they're, like he said, if you had tried to do this with me 10 years ago, I would have laughed at you. And he meant it, but he said, now he's in it. Like, I'm in it. I can't keep going like this.
Yeah.
And so, my other question that I always ask people is, what in your heart of your hearts are you worried about?
What did he say?
He said, I don't want to end up like the older doctors.
Yeah.
Who are just all grumpy. They feel bad all the time. They all divorce their wives. They all do these things. He just didn't want to end up like that.
No.
I said, well, you don't have to.
Right.
So, but that was good, because he kind of like, what's going to happen if you don't do something about this?
Yes.
Sometimes they need to kind of like consider that. I know what you want to look like. What's going to happen if you don't do something about this now?
Exactly. That's exactly right. Right. You have to have some skin in the game in the end.
Yeah.
That was great. It was a great story. I love this. I love it. Thank you, everybody.
All right. Leave us your thoughts. Join our website, www.toughtotreat.com. We'd love to hear your thoughts. Drop us a line. Let us know what you're thinking. And if you have not, what am I trying to say? Rate our website. Rate? What am I saying?
Oh, I mean, giving us a review on iTunes.
Yes. Give us a review. Sorry.
Or wherever you listen to the podcast.
Yeah, whether it's on iTunes or wherever you're picking us up from, please do that. It helps everybody else find us.
Yes,
I love hearing from people who have found the podcast and find it helpful. So help us get this around to other people too. We would really appreciate it. Thank you so much, everyone, and we'll see you next time.